Okay. Hello and welcome everybody to this new series that I have started called Understanding the Basics. Okay. And this is going to be covering all the health topics, various health topics, which most of us go through during our lifetime. And today I have my very special guest, and she's my first guest, and her name is Roopashree. And I would love to let her introduce herself, but she will be talking about diabetes, and we will learn a lot more about the basics of what illness is about. So, welcome, Roopashree. Thank you so much for joining me today. Why don't you
Yeah,
introduce yourself?
yeah. Hi, Anju. Thank you for giving this opportunity. To start with, I'm Roopashree. I'm an engineer by profession, but I developed my interest in yoga. So I did my course in yoga instructor course from SVF University, and I did my diabetic course as well. So I'm a diabetic therapist and a prenatal therapist. So yoga was my lifestyle, and it changed my life, and I'm towards having a healthy lifestyle. So, so
That's wonderful. So, what do you mean by you're a diabetic therapist? So, what do you exactly do and where do you work?
yeah, diabetic therapist, people having a diabetic condition,
Hmm.
so will have a lot of apprehensions, and they have had to undergo a lot of lifestyle changes. So we help them doing yoga postures, which help them to activate their pancreas so that they can still lead a normal lifestyle and have a healthy lifestyle, and control their diabetes with medication, and of course with proper nutrition and good lifestyle.
Wonderful. So let us just go to the basics of it, okay? Because I want to understand it just for myself. And of course, the purpose of this series is to inspire the younger generation to learn about these things and be take preventive actions, right? Hopefully, to and also inspire them to build a healthy lifestyle. So, what is diabetes?
Okay. See, diabetes is a condition where pancreas is not producing sufficient insulin, or it is producing, but it is not sufficient to break down the blood sugar in the bloodstream. So that condition helps in accumulation of glucose in the bloodstream. So this is the condition. It is not a disease. It is a condition that is called as diabetes.
Okay. So we often use this phrase, right? Like my blood sugar has gone up or my blood sugar has gone down. So why do we say that? What does that mean when they say my blood sugar
As
has
I
gone
told
up?
you, as I told you, this see, I'm just going towards the biology. Like whatever we eat as a food, it is digested and it is converted into starch, and that is through intestine. It is released into the bloodstream. That is how our body works. And those food in the form of starch will be circulated through the blood to all the each and every cell. So every cell will receive its starch, and when we are inhaling, there is oxygen taken into the lungs, and that again goes through the bloodstream, and it is again distributed to all the cells throughout the body. So the glucose, in combination with oxygen, it is oxidized to release carbon dioxide, water, and energy in the form of ATP, adenosine triphosphate. So this energy, whatever is released, is used up by the body for our regular activities and for our external activities. And this is how the whole system works. So, and those energy, once it is depleted, we again feel hungry and we again consume food. Again, the process repeats. This is how
Right.
the normal body works.
Works.
But what happens in case of diabetes, there is insulin which acts as a catalyst, which is again taken through the bloodstream into the each and every cell, and that initiates this oxidation process or pushing the glucose C6H12O6, that is the formula for glucose, into the
Glucose.
each and every cell.
Okay.
So when that insulin is not produced properly, or it is insufficient, or the pancreas is not working, so that is again leading to insulin, the glucose again, which it will be accumulated in the bloodstream. It will not be taken into the cell. So that causes high blood pressure, high
Blood
diabetes.
sugar.
High,
Ah, I see.
high.
So now there are two types of diabetes, right?
Yeah.
type 1 and type 2? Is there a
Type
difference between them?
Yeah, type 1, no, even with my limited knowledge, I'm just trying to explain. Type 1 is somewhere there is an autoimmune system in your body which is acting against your beta cells, which is there in the pancreas, which produces insulin. So this
Okay.
is actually a inborn, or it could be right from your childhood. So that
Ah,
can lead to a no insulin or very less insulin production. So that
I
is
see.
type 1. Whereas where in type 2, where the pancreas is still producing insulin, but that is not sufficient for the body to process its glucose. So the insulin is either insufficient or or it is not producing properly. So
I see.
that is not sufficient for insulin to push the glucose into the cells.
Okay. So, but type 2 diabetes is what we hear, which is very common, right?
Yeah, it's
Uh,
very common. Yeah. Type 2 can be monitored and it can be controlled very well with
Okay.
proper care and uh, lifestyle. So that is definitely can be controlled with proper medication. Have a team of doctor, and you
Okay.
have to monitor your lifestyle and
Mm.
improve your overall well-being. That can be easily controlled, and to some extent it can be reversed.
Oh, it can be reversed as well.
Yeah.
Oh,
Yeah.
that's great. Okay. So, so how do we, when does this diabetes as a condition start? What, is there a particular age group, or I've heard the word juvenile diabetes also, which is not very common, I guess. But what is the typical
Yeah,
age?
diabetes generally type 1 is related to your genetics, and it can start from your childhood. So because it is subjected to your immune system and it is attacking your pancreas, whereas type 2 can be uh, could be your lifestyle also.
Okay.
So nowadays most youngsters are into non-healthy eating habits, eating junk and lot of carbohydrates intake, and a very sedentary lifestyle, not much into uh, physical active lifestyle. And so those things can lead to obesity, and in turn can lead to this condition.
Diabetes. So,
Yeah, so it can come to any age group, yeah, right from 40 plus, like it is again depends on your lifestyle. So
correct.
if it is not a good lifestyle, it can occur at any age.
I see. Okay. So, what are some of the symptoms? How, like the first initial
Yeah.
symptoms, or how can we even,
Yeah,
think
you
about?
feel very thirsty. It could be a frequent urination. It could be extreme hunger or slow healing wound, or it could be a blurred vision or frequent infections. So these are some of the things you have to watch out if you're having that condition is there in your in your body, the diabetic condition.
Okay. So, so that is it possible that we cannot have any of these symptoms, and suddenly one day you go to the doctor and they diagnose that you have you have
Yeah.
diabetes?
Correct. See, sometimes diabetes it could be a mild case where it goes unnoticed. Maybe the frequent urination thirst may be there, but it is compensated by drinking fluids very frequently. The blurred vision, if it can be attributed to a old age, maybe 40 plus, if you have blurred vision, maybe it is not recognized. But in just in case this is continued and it is not given proper care, or if it is not controlled, it can lead to organ it can affect your organs. Like it could be a circulatory system. There is as in heart or circulate or kidney or
Okay.
your nerve damage. So it can lead to these damages in the if it is not treated and diagnosed at the
At
earliest.
the right time, right?
Right. Yeah.
Wow. Okay. So the risk factors are pretty high if it's not. So do
Correct.
we get let's say we don't have any symptoms, a fairly healthy person. Um, do you recommend them to get tested even if they don't have any symptoms and they're doing fine? Is it like do they do a normal blood sugar test just as your regular physical checkup?
Yes. See, most of the corporates are promoting annual health checkups. Are So that is something that even also every people should implement that as a part of their lifestyle. So getting annual health checkup, a regular checkup, random blood test can help you to prevent the occurrence, or if it is in a borderline, it can be taken care and can be reversed. So I recommend that everybody should go for an annual health checkup or a regular blood test, or once in 3 months or once in 6 months, so that you can prevent it from further damage. Because diabetes, if it is not treated properly, it can go to any organs, it can lead to any organ failures in future.
Okay. Okay. So, before going into like the treatment of all of the symptoms and stuff, can you tell a little bit about juvenile diabetes? Did we mention talk about it earlier?
Juvenile diabetes, again, it could be due to
Does
the
it
type
happen
1.
for like kids? Is that why it's called juvenile diabetes?
Yeah, looks like, yes, yes,
Okay.
because it could be a type 1 diabetes,
Yeah.
where, as I told you, it's saying that immune system is attacking, it's not letting the beta cells producing the right hormones, insulin. So
Mm.
that could be a juvenile, and it could start from your childhood. Whereas
Right.
the type 2, it is due to the lifestyle. So,
Ah, okay. 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 And you mentioned you work in a prenatal as a therapist, right? So that is so what exactly is that? Because I want to talk about gestational diabetes, which happens in pregnancy.
correct. See, prenatal is it is for a pregnancy yoga, where we recommend women who are expecting their child to start their yoga if it is everything is normal, and with the, of course, with the consent of their gynecologist, and to start their yoga practice right from their fourth month or fifth month onwards. So
Hmm.
that in that postures, we also ensure that there is a lot of stretches happening, and ensuring the muscles are getting strong. And that yoga can also prevent gestational diabetes, because
Diabetes.
that happens during your pregnancy, where there is a diabetes during pregnancy, and it will vanish immediately after the child.
Oh, okay.
So
Yeah, yeah.
it's only a temporary phase where you have diabetes during your pregnancy, and it will just go away.
I see.
But that needs to be again monitored, because if it is not taken proper care postnatal, like for after childbirth, that
Yeah,
can even lead to type 2 diabetes
type 2
if proper
diabetes.
care is not taken.
With so let's talk about care and management and treatment. So let's say somebody is diagnosed with type 2 diabetes. What are the most important first steps you would say in
Uh,
managing?
Yeah, first is they had to understand uh, what is diabetes. They had to understand what is this condition. It's not a disease; it's a condition. It's a body condition. What is it all about? And just to know about what is type 1 diabetes, type 2 diabetes. So then the next thing is build up a proper team of doctor where they can go for a regular checkups. And then next is they have to undergo the blood sugar test very frequently, as in required, like once in 1 month or 2 months blood sugar test. And then they have to also have monitoring on their nutrition intake. So wrong carbohydrates, too much of oil, it is not good for the body, because it will not get digested, it will not get broke down into a proper glucose, and it is not, the insulin is not able to process those glucose. So you have to take a more of fiber diet, where it is soluble, and for insulin, with the limited insulin supply, it can help the cells to absorb and process that. So also and very healthy lifestyle, and lot of exercises, movement, and a positive mindset, and avoiding stress. So those things are the changes they have to bring in about. It is more of a disciplined lifestyle. So if this has been implemented, when they are diagnosed with diabetes, definitely they can take care of themselves, can be monitored, and it will be under control.
Okay. So can you give a little bit elaborate on how nutrition works in managing diabetes? Like how,
Yeah,
what kind of
right.
foods to
So
avoid, what kind of foods we have to consume?
yeah, right. To start with, so whatever you see, this is a balanced diet we call. It's a carbohydrates, you have proteins, vitamins, micronutrients, water, and refuges, that is a fiber. So this
Right.
is a balanced food we always recommend for the body, because carbohydrates take care of your burning your for your physical activity, whereas protein or the bodybuilding component, vitamins and minerals are for your immune system, and refuges for your digestion and assimilation and excretion of your food. So these balanced diet is very important. But even in the carbohydrates, taking a healthy carbohydrate is like whole wheat, lentils and cereals, and those things can help in having a proper carbohydrate. And fat also it's required, because it is acts as a blubber, and it acts as a it gives the energy for the body for its activity. So that is ensuring the balanced diet. And also in the carbohydrate part, having the proper, like avoiding the processed food or maida, or those things can help you to have a proper lifestyle, and help you to help the insulin to digest the food whatever has been taken, and control your diabetes. Because excess eating or excess non-healthy carbohydrates can bring a lot of accumulation of glucose in the bloodstream.
I see. So you would say not a bad, in fact, you want to reduce the carbohydrates,
And
right?
carbohydrates, only consume healthy carbohydrates and a lot of fibrous food, like
Correct.
which vegetable which has fibers in that, or the food which has fibers. So that
Yeah.
is recommended, because it is easy to digest, and it is soluble, and
Mm.
it is easy for insulin to push those glucose into the cells. So that is,
Okay.
it helps them.
So like complex carbohydrates is better.
Yeah, correct. Yeah.
Okay. Okay. Nice. And so with these nutrition is one thing, of course. Lifestyle, let's talk a little bit about stress now. Everybody is stressed out, right? Like everybody, because of their work and the way the life itself is, there is so much stress. So I think that is one of the main reasons why people are getting diagnosed with diabetes at a very earlier age, right? So why does it happen? What is stress, and why does it affect your blood sugar? How does that work?
Yeah. Yeah. To start with stress, I just want to bring in the psychology aspect of it.
Sure.
Stress has two parts. There is good stress and bad stress.
Yeah.
So suppose before you are entering to perform on a stage, you are
Correct.
stressed. So that is a good stress. That is bringing a positive change in you, and you will be performing well. So
Correct.
you're going for an interview, there's anxiety, there's stress. That's only to bring in the best part of you, that keeps you activated. So stress is required in your life, because good stress will motivate you and do something better.
Okay.
Whereas bad stress, which is like you're stressed about the environment, stressed about the traffic, stressed about your work, which you're not able to manage, time management, those things can deteriorate your condition. So
Mm.
you have to focus, you have to understand first stress, understand the root cause, and be aware of those stress, mindful. Be
Correct.
mindful about your stress, can help you to recognize your good stress and bad stress, and work on your bad stress and reduce that. So maybe time management, can get up early, or proper timetable, or
Mm.
work related. Maybe you can't take up more assignments, confine yourself what you can do, where what you can have on your plate. So those things, minor changes in your body, in your lifestyle, can bring in to reduce your bad stress. Whereas good stress are definitely required to keep you motivated and happy. Otherwise, we'll be just lying down and say nothing, nothing is there in my life. I need not do anything. So that is
Mm.
also not right. So
Correct.
even the exercise, whatever we are recommending, that is also a result of good stress. Okay, I want to do something. I want to keep myself healthy. That is a good stress. That is motivates you to have a better lifestyle. So that is how you can manage your stress. So definitely stress is required as in good, but bad stress need to be understood, be aware of it, and then it should be managed.
Managed. So, what
Yeah.
happens if you're stressed constantly? Does it increase the sugar level in your blood?
Yeah, definitely. See, stress will have it's a mind over body. Its mind will affect your body, because there's a lot of hormones are produced, and if the mind is calm, the body will function normally. But if the mind is stressed, it will affect your pancreas, and in turn the production of insulin, again there is a lot of disturbances, and that again results in this disorders and this diabetic condition.
Okay. So
So
there's
psychological, yeah,
sure. So there's nutrition that can be managed and adjusted to maintain the diabetes or manage the condition. There is
yeah,
stress management that is required, and let's come into physical activity. Right, that is important, right? The to
correct.
manage diabetes.
Yeah,
So, what kind of physical activities? And definitely, we have to talk about yoga here because that is one of the best ways to, reduce stress, right?
right,
So,
right.
yeah, go ahead and tell us a little bit about physical
Yeah,
activity,
see,
how it
yeah,
helps.
yes. To manage diabetes, healthy weight is very much required, because if you're obese and there's a lot of fat is accumulated in the body, it is very difficult for the body to manage its weight. So healthy weight is required. For that, you had to incorporate exercise as a part of your lifestyle. It could be aerobics, like you're walking, running, that is all cardio. You can do it, or it can building your muscles, weightlifting. So again with the help of your proper guidance or your instructors, you can incorporate this healthy lifestyle. So the as basics as walking, running, jogging, and these things
Mhm.
can help you to monitor your blood sugar. You can monitor your weight, and you can reduce your chances of increased diabetic condition.
Mhm.
So definitely exercise will help you to keep the diabetes under control.
Okay. So, how does yoga intervention help with diabetes? Because we hear a
See you.
lot about, yoga practitioners talking about, do this asana for reducing diabetes. Do so they keep saying that. So I'm curious how yoga helps in diabetes.
Yeah, yeah. To start with yoga, it is a different subject as well. We can go on for hours together, but just to give you a brief, yoga is about your mind and body coordination.
Correct.
It is called Sukham Sthiram Asanam. That is when you are at peace, when you are calm and relaxed, your body functions at its optimum best.
Okay.
So that is enabled during yoga. So
Mhm.
whenever we are doing postures or asanas during yoga, it is mind and body. Mind is relaxed and body is relaxed. And you are free from all the thoughts. Mind is completely thoughtless. So during that, your body is completely in sync with your mind, and it is functioning very well. And all the organs and all the hormones are produced at its optimum level. So
Okay.
that is how it helps in managing diabetes.
I see.
So there are a lot of postures like pancreas activating postures in yoga. So they are called Vakrasana. That is where you are twisting something which related to your waistline. The pancreas is situated at this waistline. So
Okay.
Vakrasana, Trikonasana,
Oh,
Parivrita Trikonasana, Gomukhasana, Bharadvajasana,
oh.
Janu Shishasana, and a lot of twisting postures which
Mm-hmm.
will help you to activate your pancreas, and
Mm-hmm.
it will help you to manage your diabetes.
Oh,
So
wow.
that is one part. And we
Huh.
have a lot of relaxation techniques in yoga, like a deep relaxation, quick relaxation. So those things will help you to completely relax your mind, and your mind is relaxed, your body is relaxed. This will enable to remove all your stress, all your thoughts. So
Mm-hmm.
then the body is, once it is relaxed, it will go into your optimum level of its functioning. So
Mm-hmm.
that's how even the pancreas will get activated, and can produce the required insulin over a
Mm-hmm.
period of time, and it can be very well monitored, and diabetes can be controlled through yoga.
Wonderful. So I do want to talk a little bit about breathing and pranayama.
Yeah,
So let's disconnect this call and join again because we are running out of
yeah,
time. Okay.
sure.